Hi, my name is Jennifer DiBenedetto, and I'm going to be presenting on self-care strategies for nurses and nursing students. So this topic is really important because nursing is such an extremely fulfilling but stressful profession. So not only is nursing so fast-paced with a heavy workload, but you often have to cope with a lot of emotional pain over the interaction with people who are ill and suffering. So practicing regular self-care can not only help you counteract and manage the stresses of the nursing profession, but also help you avoid serious issues such as exhaustion and burnout. So this presentation is going to offer some strategies to help you deal with a lot of the stresses of the profession and allow you to even do a little bit of self-reflection of how you can be able to employ self-care strategies into your life. The objectives for this presentation are to 1. Identify complementary strategies to reduce stress. Also to identify ways you can improve self-care in your life. Learn how stress and burnout can be mitigated through self-care strategies. So this slide is about the American Nurses Association's perceptions on self-care, and there is a great YouTube link that allows you to watch the video called A Healthy Nurse, Better Self-Care, Better Patient Care. Be able to watch the nurses' perspectives on how self-care affects their lives and how sometimes nursing can be a really stressful profession, but a really rewarding one as well. Stress is a very common phenomenon that occurs in everyone's life. Regardless of who you are and what you've been through, you are typically going to enter a stressful situation. There is a good thing about stress, and that stress can be a motivator. It's actually essential for survival by activating the fight or flight mechanism that can tell us when and how to respond to danger. But the issue is that we're built to only handle stress for a very short period of time. But when you're in nursing school or working as a nurse, that fight or flight mechanism is in constant overload and it's constantly working. And over time, it can really undermine your mental and physical health and become really harmful. I actually was able to come across an annual stress survey that was conducted by the American Psychological Association. And they found that the average stress level in the U.S. rose from 4.9 to 5.1 on a scale of 1 to 10 in 2015. And one of the main reasons was employment. And as nurses, we want to try to minimize as much stress as possible because it can really be something that is harmful long term, and it can lower your life expectancy, and it can really affect your whole body's mechanism as a whole, regardless of whether or not it is acute or chronic stress. So it's really important to pay attention to the fight or flight mechanism because we want to try to limit as much cortisol production as possible. And you can even see on the other picture that you visually see how stress can really affect somebody both internally and externally. Whether or not you're sweating or having headaches or muscle aches or having trouble sleeping, high blood pressure, low immunity, stomach upset, it really affects every single aspect of your body. And those are just the physical reactions. There are even emotional reactions such as anger, anxiety, burnout, nail biting, forgetfulness, and even behaviors such as heavy tobacco consumption or crying or relationship problems. And all of these things are just manifesting from what stress can do for the body. So it's really important that when we continue to go through life and we contemplate, are we in a stressful situation? Being able to identify a lot of these symptoms can really help you determine, okay, I have been feeling like this for a long time. Maybe that there is something that we can do to help mitigate that. There are many causes of stress that a person can experience, and they're usually through either external or internal factors that really can precipitate a stressful situation. So in the external category, there is work or school, so such as working as a nurse or even being a nursing student, just that high intensity stress that can really be harmful. The next being relationship difficulties. So if there are issues going on in your family or friend life, it can really become harmful and stressful in that way as well. Or if there are any financial problems, major life changes, or even just having your children and family can be really stressful as you're trying to juggle and manage your life. Whether or not you are a student trying to just prepare for exams, or you're a nurse and just trying to calm down after a really stressful shift, and then you're going home to stress with your children needing your attention, or even your spouse needing your attention, or really anybody. It just really creates this busyness that can be really stressful and just really common that can happen to anyone. Or it could be an internal cause of stress. So these can really present themselves in really pessimistic kind of ways. So if you're just really feeling negative or you just have a negative outlook on life, sometimes that can precipitate stress. Also, the inability to accept uncertainty, which really goes along the lines of not knowing what's going to happen in the future. Am I going to be a nurse? Am I going to pass that exam? Or, oh, am I going to have a really difficult assignment today or not? Also, there is rigid thinking, a lack of flexibility, and just not really having any sort of open-mindedness, or even negative self-talk or unrealistic expectations, and perfectionism. I find that a lot of people, especially nurses and nursing students, really struggle with this one in particular, with perfectionism. We all are very type A at times, and a lot of that can really precipitate stress because we really place these unrealistic expectations to be perfect, to get the A on the test, or give the highest quality patient care that you can with no mistakes. And it's really unrealistic because we're human. We either forget or, we're fatigued or whatever the reason may be. So, but it's a really big problem, and it's something that we're all struggle with at times, or even the all or nothing attitude as well. There are many effects of chronic stress, and it's really important to understand how stress can affect the body, because you may not think that you're stressed and that, oh yeah, I'm not a stressful person, I can certainly handle stress, until you realize, oh, I have a lot of these symptoms. And it's really as a result of chronic stress, or even sometimes acute stress, depending on how your body works. A lot of the common symptoms that you can experience are depression and anxiety, pain, digestive problems, heart disease, weight problems, reproductive issues, and it really can manifest all over the body. And as you can see in the diagram, the whole organ and organ systems all around are affected. It's really not localized to one particular area. I mean, you can see stress everywhere. And 95% of illness is shown to be caused from stress, because stress is just such an inflammatory, lowered immune system function, just overall terrible for the body. And it really just does not help with anything other than just cause havoc both emotionally and physically. I wanted to focus this slide on nursing students because nursing students in particular really are stressed, and they have a lot of burnout just prior to even becoming nurses. And even being a nurse who really has only been out of the profession a little over 5 years, I have clear memories of how difficult it was to be in nursing school, to prepare for exams, and really trying to manage my family, my friends, and anybody around that oh my God, the poor people who had to deal with me. There are just a lot of expectations that are placed upon you. And it's just a whole trying to manage the work-life balance and trying to study. But really, the most significant thing, I think, is the pressure. Because pressure can really come from your professors, it can come from your parents, it can come from your friends, it can come from really any single person that hears that you're going to be a nurse and they're like, oh, so that means you're smart. That means you're going to get the A on the exam. That means you're going to pass. And sometimes you're feeling like you're biting off more than you can chew and you can barely get ahead, and it's difficult to cope with that. So a lot of that can really precipitate and make you think to yourself, do I even want to be a nurse? Many people are even starting to consider nursing to be one of the most difficult undergraduate professions out there. And even if you decide to go for an advanced degree, that is still a very difficult profession and difficult to pass. And it just really can wreak havoc, and it is just something that nurses struggle with, and it's almost like a really terrible initiation. I wanted to take a moment to really talk about what burnout is exactly, because we always hear about nurses being burnt out, but what does that mean exactly? I looked at Valcor's article and I was able to get three main components of what comprises someone to be burned out. The first being exhaustion. And exhaustion is the central symptom of burning out. It comprises of physical, cognitive, and emotional fatigue that undermines people's abilities to work effectively and feel positive about what they're doing. The next is cynicism, which is actually also called depersonalization, which represents an erosion of engagement. It is essentially the way of distancing yourself psychologically from your work. So what I mean by that is that instead of feeling invested, whether or not it's your assignment, your project, your colleagues, nurses, patients, doesn't matter. You're just so detached, negative, and may even be callous towards them because you just can't even function throughout the day. The last one is inefficacy. And inefficacy refers to feelings of incompetence and a lack of achievement and productivity. So people with this symptom of burnout feel that their skills are slipping and worried that they're not able to succeed in certain situations or accomplish certain tasks. It often develops in tandem with exhaustion and cynicism because people can't perform at their peak when they're out of fuel and have lost connection to their work. So in a lot of ways, all of these three symptoms all really correspond with each other, and they are all jumping back and forth from one to the other, and it really just depends on the day of how you feel. But I feel like most people can even relate to the nurse in the picture when you are just completely been doing this for 30 plus years and you just feel like you have had enough. And I just thought that this picture was a really funny example of how nurses may be feeling when they're burned out. Self-care has a multidimensional model that really comprises one to have healthy self-care. The first one I want to go over is spirit. Spirit revolves around spiritual needs of a person, such as engaging in activities that bring meaning to your life, or even if you're religious, or you just want to walk out in nature or the environment, or even something such as volunteering or helping others can help raise your spirits. So the spirit is a really important component of self-care. The next is the emotional aspect, and the emotional, it gives permission to have and express emotions. So it's all about being heard or understood, or even something such as debriefing after challenging incidences. So whether or not you've had a patient die in the ICU and you feel like you just need to debrief and just talk about what happened, that alone can help really contribute to your well-being. Or even just doing something that brings you joy or energizes you. The next one is the body. So the body is often something, easy to understand, but at the same time it's very commonly neglected. This comes in the form of physical health, sleep, nutrition, and exercise. The next is relationships. And relationships are all centered around having healthy, supportive, and nurturing relationships. This can come from your family, your friends, professional organizations, clubs, networking, any of those times where you can be able to interact with people who make you happy. But the interesting thing is that even if you decide to take a sick leave, that also is really helping with yourself and being able to focus on, the relationships that are away from work. And that is a really important thing that I don't think that a lot of people do. The next is work, which is all about a manageable workload, support from your supervisors, managers, and colleagues, even taking a break from work, because I find that a lot of nurses don't do this. And a lot of the times it's because nurses do not have the time to take a break, which is really unfortunate, because how can you care for other people when you haven't even fed and fueled yourself? And it just really is all about how can we move towards meaningful and satisfying tasks and an overall professional development at work, and how that can really help foster a healthy self-care model. The last thing is the mind, and that is taking care of your psychological health and managing stress, managing personal development, and helpful self-talk. Even if you decide to just talk to your colleagues or talk to a psychologist or something to really help take the mind off the stress of your work, that can be really beneficial to you in the long run.